You can hear and see me. Okay, yeah. No.
Hello?
Oh, yeah. Okay. I think we are sorted. Okay, well, colleagues, we are going to start just now. We're just trying to fix it. No, kusebenza leyo. Mina bekuzama ukutest in case ingalungi ukuthi ihamba kanjani yami. Ivolume yami.
Hello, colleagues.
Yes, they can hear us. MEC for Health, MEC Nomagugu Simelane-Zulu, as well as MEC for Education, MEC Kwazi Mshengu. We are here for our weekly updates in terms of our COVID situation and other related developments as the province of KwaZulu-Natal. Without any further delay, I'm going to hand over to the Honorable Premier to take us through. We do have colleagues that have joined us online. In case there's a challenge, I think they can indicate to us via the phone. Over to you, Honorable Premier.
Thanks. I'm not sure whether I shouldn't switch off. Thanks, Mr. Mabaso. I believe I'm audible even to those who are connected via the social network. Let me extend our greetings to all of you colleagues. Special acknowledgement to MEC for Health in KwaZulu-Natal, Honorable Nomagugu Simelane-Zulu.
Please mute yourself, guys.
MEC for Education in KwaZulu-Natal, Honorable Kwazi.
Please mute yourself, guys.
Members of the media, ladies and gentlemen, thank you for honoring our invitation to this media briefing. Your presence always presents us with a very important platform to inform the people of this province and those watching and listening throughout the country and as well elsewhere about how we are doing insofar as dealing with this massive challenge of COVID-19. We wish to start by welcoming and applauding the President of the Republic, His Excellency President Cyril Ramaphosa, and the National Command Council for the leadership they have continued to provide as we navigate the health crisis of unimaginable proportion. Ahead of the first confirmed case in South Africa of March 2020, the President and the Cabinet have provided strong leadership in tackling COVID-19. They've always shown exemplary leadership and courage during some of the most difficult times that we've seen. We welcome the pronouncement by the President and more especially the decision to ease some of the restrictions while sustaining the country on adjusted level 3. We have cause for optimism. With regard to the arrival of the vaccine, we take this as a historic moment. As yesterday we witnessed the arrival of the Oxford University AstraZeneca vaccine from India into South African shores. As the province which had the first case of COVID-19 in the country, we're extremely delighted to be part of this giant leap by humanity, which marked the beginning of our march toward the victory against this deadly virus. This is a solemn moment to pause and reflect on the devastation that has been caused by COVID-19 in our lives, and to remember all our loved ones who have sadly left us due to this virus since March 2020. We extend our heartfelt appreciation and thank the people and the government of India for the solidarity and support. Because of them, for the first time ever, we can now boldly say that we have an even stronger and more direct line of defense against the virus. to complement the non-pharmaceutical and therapeutic treatment interventions that have been relied on heavily in the past, which must still be continued and not be abandoned. With regard to KZN plan to roll out the vaccine, as the province of KwaZulu-Natal, we've developed our own vaccination rollout plan based on guidelines set by the World Health Organization and the National Department of Health. Our plan focuses on the management, distribution, and dispensing of the vaccine. The province has established a vaccine coordinating committee, which include private sector, hospitals, traditional leaders, eThekwini municipality, health systems trust, organized labor, NGOs, especially the PEPFAR, which has always been our partner, the academic sector, the National Health Laboratory Services, the civil society, and the South African Military Health Services, among others. The Provincial Vaccine Coordinating Committee is chaired by the HOD for the Department of Health, Dr. Shabalala. Across the province, all our districts have finalized vaccination distribution plans. We have pillars of the vaccination plan, and this starts by ensuring governance and coordination. The Provincial Command Council will support, monitor, and perform oversight over the vaccination process, especially the rollout. We have phases as cascading from the national plan. And phase one is divided into two. That is focusing on staff in direct contact with patients. And these are healthcare workers and support staff. Two, staff not in direct contact with patients, and these are administrative and other staff members. The provincial first beneficiaries are targeted as follows. One, the public sector healthcare staff, which is about 67,644. Medical doctors, dentists, pharmacists, emergency medical services, and all of them are around 9,292. Interns are around 390. Nurses, 34,279. Non-OSD staff, 20,417. Allied health professionals, 2,639. Engineers, artisans, 366. Staff providing social services, 256. Privately contracted staff working in public sector, 14,625. Traditional healers, 5,939. Military healthcare staff, 350. NGOs sector staff, 6,699. Environmental health practitioners, 360. We have also presented the distribution, the breakdown per district. And per district, we can tell you how many staff in terms of clinical and support staff. And we do have a breakdown that we will provide you that talks to all of these categories per district. But maybe to give you grand total, in terms of Amajuba, we will be dealing with about 3,573 staff members, both supportive and clinical. eThekwini, 20,360. Irikwala, 2,935. The head office of the Department of Health, 1,155. Ilembe, 3,534. King Tetwayo, 6,227. Ugu, 4,752. Mkungunlovu, 9,093. Mkanyagude, 4,596. Mzinyathi, 3,635. Tugela, 3,389. Zululand, 4,395. The total will be 67,650. In terms of identification and prioritization of targeted healthcare workers, a total of 163,156 healthcare personnel from various sectors in KwaZulu-Natal are eligible to receive vaccination during the first phase, as announced by the President. These include 81,000 healthcare workers in the public sector and about 49,000 in the private sector. We've developed a pre-registration system for healthcare workers per facility. In terms of vaccination sites, the vaccine will arrive in the province of KwaZulu-Natal on the 14th of February. Staff in direct contact with patients will be prioritized. To date, the province has identified 91 vaccination sites, which will include all public hospitals and community health care centers. These hospitals and community health care centers will be responsible for the clinics and other sites that are part of the value chain in their catchment areas. In terms of monitoring and evaluation, every vaccinated person will be observed for a while before being discharged after being vaccinated. But also, as we have said that we've developed a register, we will be able to consolidate numbers on each and every day on how many people have been vaccinated.
Colleagues, please mute.
In terms of communication and awareness, a communication and social mobilization strategy has been developed to ensure that all our citizens are well informed about vaccination and the rollout. We'll ensure that our communication strategy covers all areas and reach all people who are prioritized for vaccination. When it comes now to the trend analysis, when we move over to the status quo for COVID-19 in KwaZulu-Natal, our province has observed a decline in the number of new cases weekly. The KwaZulu-Natal province is currently the second highest countrywide in terms of laboratory confirmed cases. The overall percentage changed in the number of new cases between week 3 and week 4. When we talk about week 3, it's week 3 of January, week 3 of 2021. And that week 3 is a period between January 17 to January 23. And you compare that week with week 4, and week 4 is the 24th of January to the 30th of January. And the decline between these 2 weeks is about 51%. The actual number of cases was 22,608 for week 3. And for week 4, it was 11,099. Now you will see that decline of about 51%. Over the past week, the highest number of cases received was was 2,079, which was on Tuesday, 26 January 2021. The average number of cases recorded daily was 1,777 cases per day. Due to the population size, eThekwini has continued to record the highest number of new cases daily. However, the proportion of daily cases has declined to below 40%. Recently, King Cetshwayo district has been recording the second highest number of cases daily. And in fact, there were days whereby King Cetshwayo recorded more cases than eThekwini district. And that is in particular the 25th and the 29th of January. We saw King Cetshwayo recording more numbers than even eThekwini. We are concerned by the number of deaths reported daily. The actual number of deaths which occurred in week 3 was about 796. And for week 4 was 265. The second wave has been more severe than the first wave in terms of the deaths in the province. The average number of deaths received daily over the past 2 weeks was 75 deaths per day. The analysis was done using the date the person died, not the date of reporting. Within the province, Umgungundlovu district has the highest death rate, followed by eThekwini, Amajuba, and King Cetshwayo. In terms of hospitalization, the number of hospital admission has declined, along with decrease in the number of new cases in both public and private sector. This is also in line with the incidence and positivity rate. The number of admissions started increasing steadily from December 1 and then declined from week 3 of 2021. The number of ICU patients has remained constant for the month of January. The province currently has 3,601 patients admitted in both private and public hospitals as at the 31st of January. And private hospitals has about 67% of these 3,601. In terms of actual numbers, patients that are in private hospitals are 2,429, and those that are in public, it's 1,172. And in public, it means we have 83%. Of those admitted, 483 patients required intensive care services, and that is 13%. Among those who required intensive care, 44% were being ventilated. And in terms of numbers, that is 211. So that is all in as far as the state of COVID-19 in the province. Let us take this opportunity to update you, colleagues, and the people of our province about the state of readiness for schools opening on the 15th of January. The province of KwaZulu-Natal is ready for the opening of schools on the 15th of February 2021. Our main aim is to have the first lesson during the first hour of the first day of school. This call for readiness in terms of learner admission, availability of physical resources such as classrooms, stationery, textbooks, school furniture, water, sanitization, COVID-19 essentials, learner transport, as well as nutrition food for learners who are beneficiaries of the National School Nutrition Program. Availability of human resources, such as teachers, non-teaching staff, are very critical for the opening of schools. In terms of availability of COVID-19 essential for the safety of school communities, this includes the learners, teachers, and non-teaching staff. The Department of Education has made good progress to ensure that all the COVID-19 essentials are delivered to schools before the arrival of learners. This includes the provision of water and sanitization facilities. There is confirmation that all schools will have required, which have required COVID-19 essentials, would have received all that when learners arrive, and this will include cloth, masks for teachers and learners. It must be mentioned that schools are ready, as the schools management team opened on the 25th of January. In 2 districts where there has been challenges, those challenges of storage space, and that is provided now by the head office in the province. In terms of learner admissions, out of 2,771,015 learners expected to be admitted by schools in 2021, the province has already admitted 2,769,212 learners, which is 99.93%. Learner admission has been completed in most of the grades. The unplaced learners are mainly in grade 1 and grade 8. And this is understood because these are entry grades for foundation phase and the secondary school phase. In order to assist parents whose children have not yet been admitted, districts have formed admission committees which will intervene in cases where learners do not find space. The department also expects the walk-ins because of the factors such as the movement of parents from one location to the other. In terms of filling of vacant posts, the department noted as early as 2020 that there are vacant posts created by attrition, retirements, promotion, and even COVID-19 fatalities. These are posts for teachers, mental heads, deputy principals, cleaners, screeners, and cleaners. There is a good progress in terms of filling of these posts. To strengthen support for school functionality and productivity, office-based posts of circuit managers, as well as curriculum specialists, have been filled. In terms of surplus, the Department of Education has 3,671 educators, and 1,001 of them have been placed. The Department of Education is finalizing the placement of the rest or the remaining 2,670. In terms of infrastructure, there are schools which were vandalized and damaged by storms during holidays. The damage will be dealt with while schools are in operation, except for schools where damage is such that teaching and learning cannot take place. And in such instances, head office is working with districts to ensure that schools are ready for the commencement of teaching and learning on the 15th. Schools will not run short of water because water tankers or water tanks were installed in schools where there is no running water. We must indicate that textbooks and school furniture is also being attended, and this is one of the main requirements for schools to open on the 15th. This includes stationery, textbooks, and school furniture. There is a good progress because the province has already delivered 100% of stationery. As of today, the province has delivered 96.4% of textbooks, and the remaining 3.6 will be delivered during the week ending on the 5th February 2021. In line with the white paper 6, which is inclusive education, the procurement of brilliant textbooks have been concluded and deliveries are ready to take place. Orders for top-up schools furniture were also completed, and 100% of school furniture is in the warehouse ready to be delivered before the 15th. In terms of school nutrition, KwaZulu-Natal has 5,460 schools which are approved for benefiting from the NSNP program. The number of benefiting learners is about 2.4 million. The province is ready to roll out the National School Nutrition Program when schools open this year. However, the Department of Education has directed schools to provide food parcels even before schools open. The province has put in place a system to monitor the percentage of learners provided with food. The central monitoring system will be ready when schools open on the 15th. In terms of learner transportation, for transportation of learners, the province is ready. There are 85 contracts comprising of 495 buses, 19 minibuses, and 212 taxis. All these vehicles will be ready on the first day of school opening to transport about 42,000 learners. And for the purpose of COVID-19 compliant trips, there will be a notice displayed in each vehicle about the wearing of masks and compliance. The readiness for teaching and learning, the department has printed all the revised annual teaching plans for grade R to grade 12, and deliveries are underway. Timetable and timetabling under COVID-19 restriction. The timetabling option will not change drastically from the last year's option. Some schools will still need to alternate days so as to accommodate all learners while observing social distance. The timetabling option will include alternating weeks, platooning, alternating days, hybrid model. The choice of the timetabling option will be determined by the demand of classroom space and consumption. Therefore, the province is fully aware of the fact that the majority of schools will not be able to accommodate all learners on the 15th February due to social distancing. With permission from the Minister of Basic Education, the province will communicate the date for staggered return of learners starting from the 15th. In terms of transfer of norms and standards, there is a progress in terms of transfer of norms and standards to schools. The focus is on the transfers such as allocation of textbooks and stationery. For public ordinary schools, Section 20, petty cash, and others. In terms of comprehensive picture, we can say with no hesitation that in KwaZulu-Natal, we are ready for schools opening. And we are ready that teaching will take place the first hour, first day, of schools opening, as we said. In conclusion, the province of KwaZulu-Natal is ready and wish all learners a successful 2021 academic year. Considerable progress is being made to address minor outstanding issues, such as late admission, as we alluded to earlier. School functionality visits will be conducted by oversight committees and departmental officials on the first day of schooling. The province is also ready to implement the first phase of the COVID-19 vaccination rollout plan. We must also emphasize that while we will be allowing school visits, but we will not want anyone who will come outside and then interact closely with educators or learners. We would want to stick on COVID-19 protocol. As we conclude, we wish to advise the people of our province that the special official funeral category 2, as designated by His Excellency President Ramaphosa, for Justice Kayelishe Kenneth Mtiane, will take place tomorrow. Justice Mtiane, who served as the Deputy President of the Supreme Court and Appeal, he also chaired many commissions. He is best known for fighting for the transformation of the legal profession and for championing the human rights for the poor and the underprivileged in KwaZulu-Natal and the rest of South Africa. The special official funeral service will take place at Sharpsburg tomorrow, Wednesday, and he will be laid to rest on the same day. I thank you.
By the president last night that the Thai country has now surpassed the second wave of COVID-19 pandemic. Does the province of KwaZulu-Natal expect a third wave? And in light of this, how many systems KwaZulu-Natal by the time that business plans and less about people who want to just give us a figure as to how many healthcare workers in the province do you expect to vaccinate
what has driven the cases in King Cetshwayo, the one from Minoshni, what security measures are in place in the transporting and distribution of the vaccines? Is the province looking to secure additional staff to vaccinate? What cold storage options has the province put in place? Those are the questions for now, and then we'll take the final round. And thank you. Over to the Premier.
No, thanks. I think there is one question, only one question directed to me. But maybe just to assist, and in a polite way, Nkosiko. Now, this also is linked to the last question. When we were vaccinated, ourselves who are here, young, were there new businesses that were created at that time? If so, what happened? I'm just raising it because we must not treat vaccination process as something new. It has been happening, it's happening. There are already people trained to do that who have been doing it when we were young. All of us went through the same process. I'm just raising it in that way, and I will leave it at that level. And the MEC will take it from there. Are we expecting, Sheila, are we expecting any complications? I think the Minister, Dr. Zweli Mkhize, was clear in saying there might be a side effect there and there, but there will be people who will be monitored. And in our statement, we are saying people will be monitored for a duration of time before they are discharged after being vaccinated. So that will be monitored. And I think the MEC will then add on that. And I think these are the only questions that were directed to me.
I'm supposed to get closer to the social platform. It is afternoon, I believe. Good afternoon, ladies and gentlemen. We've had a number of questions. Let me start with the first question, which I think has been asked almost 4 times in different ways. Is there going to be a tender or a procurement process for a vaccine? There was only one process, and that was conducted by National. Beyond that, none of us are going to be engaging on any other process. National is the one who engaged the different pharmaceutical companies in terms of procuring of the vaccine itself. National then made sure that there will be distribution to the different centers in provinces and in districts. Beyond that, as a province, we would not necessarily have a particular one. So no, there's no tender that's going to be issued. There's no tender that is in place. There is no tender that is being considered at all. Distribution in relation to the vaccines themselves. As soon as the vaccines have concluded their quarantine days as indicated by the minister, they will then be distributed directly to the provinces and to the districts as indicated. Other provinces have decided to centralize the issue of the vaccine. In other words, the vaccine will go to a provincial center, and that is where it's going to be held. However, as a province, we've decided to have that particular process separated into 2 different processes. There will be vaccines that are going to be held at our provincial depot, which is here in eThekwini, but each and every district is also going to have its own center that the vaccines are going to be delivered directly to. And these centers are not centers, are centers that we always receive medication, we always receive vaccines. So there is absolutely nothing new that we are going to have to do to these particular centers, because it's centers that have always received vaccines anyway. The Premier was talking about the vaccinations that he himself received as a child, and all of us, if we are South Africans in this room, growing up, we've always received vaccines, and that process, the same process that is going to be followed. The people, I see some of the people, older people, are remembering, Premier, that they got vaccinated somewhere on their left shoulder, and they are feeling that already, or they are feeling that again. So that process that have always been followed will continue to be followed. Young babies that are born today, babies that were born yesterday, babies that were born 2-3 days ago, were vaccinated with the FX vaccines, which have nothing to do with this particular vaccine. Now, that process is exactly the same process that's going to be followed. Our health workers that were trained to vaccinate young people are still going to continue to vaccinate ourselves and all the other health workers. Granted, this time we are going to have to vaccinate far much more than the daily babies that are born, or the 6-month-olds that come every day, or the 3-year-olds that come every day. Because remember, our vaccination process as well also has duration. Sometimes you are requested that you come back to the facility. A baby has to be vaccinated when they're initially born. Then I think about 3 weeks later, then it's another 6 months, it's another 3 years, and so forth. So that is the process that all babies follow. Of course, because now the majority of us are going to have to be vaccinated as a province, we have had to add the number of people who are going to be responsible for vaccinating over and above the nurses that are conducting that responsibility currently. We didn't have to employ new people, however. It is the nurses that we have in our different hospitals. It is the nurses that we have in our different clinics. Right now, we have trained over and above the ordinary nurses that vaccinate our children. We have trained more than 2,000 nurses to ensure that we don't run out of human resource when phase 2 and phase 3 come in particular. Phase 2 and phase 3 in particular might be a bit of a challenge in relation to numbers, because that is where you then go beyond just your health workers. The first phase talks about the health workers. The second phase talks about the essential workers, and then it adds your 60-year-old and above. It also adds those that have comorbidities. Then the third phase then speaks to everyone who is 18 years old and above. So yes, we have added about 2,000 more people who will vaccinate, but that is purely in preparation for the second and third phase, not now, because for now everyone is able. We've got more than enough health workers who can actually do the work. Are we expecting a third wave? Well, Coach Corner, we are not even sure if we are beyond the second wave as is. So at this point, we are still waiting. Like I said, we are still waiting for scientists to be able to say, are we expecting a third wave? I've not seen in any other country that has spoken about a third wave except for Japan, where Japan was indicating that they think they might be getting a third wave. We're not sure if that is something that might happen, but should it happen, we will be ready. We'll be able to deal with it as we did with the second wave. I know that you would be surprised when I say I'm not sure whether we are beyond the second wave as it is. At this point, we are not sure whether we have peaked with the second wave or we are just in a dip and we might still go up. So we also don't want to preempt and preempt incorrectly the phases that we are at, because the scientific work that we have currently is not able to guide us properly. Do we have any private players that are going to be part of the vaccine? the vaccine that we are receiving, or how the vaccine was distributed, it was distributed both for, particularly for the first phase, was distributed both for the private sector and the public sector. The public sector has more than 82,000 workers, and that is the kind, or that is the amount of vaccines that have been prepared for the vaccines in KwaZulu-Natal. By the way, that's the number in KwaZulu-Natal. But the number in the private sector in KwaZulu-Natal that we have been given is 49,000, and that is what National has prepared for. So as the private sector, we will make sure that the infrastructure is in place for our own health workers, and the private sector will be expected to do the same in relation to the health workers in particular. I think I have responded to the issues that you raised. I know I might have missed one or two, because you actually quite a few quite a few questions. Or you then asked the number of healthcare workers to be vaccinated in the country. I will talk about the province. Like I said, in KwaZulu-Natal, we have 82,000 as public, and there's about 49 in the private sector. That is the number that we've been given. There is, however, a point that one will need to emphasize, and that is the point that people are not going to be forced to take the vaccination. So even health workers are not going to be forced to allow themselves to be inoculated. It will have to be something that comes from within. You will have to volunteer for the vaccination, and if out of the 80 health workers that we have, some of them choose not to take the vaccine, then it will be, and it will be put aside to the next phase, or in preparation for the next phase. Sheila was asking a question about whether there have been any side effects, and I think the Premier responded to that. But the most important thing, Sheila, that we want to emphasize and request our people to listen to, especially when we get to phase 2 and phase 3, is that when you are required to stay at the center of a vaccination at that time for a particular period, please do so, because the intention of that is so that the health workers are able to pick up whether you are reacting or not to the vaccination. Any vaccination, generally, we are told, you will react to it within about 30 minutes or so. If there is no reaction or serious reaction after that, you then you could be okay to go home. However, there are people that generally in life always react very badly to any vaccination. There is a particular percentage that scientists talk about, and those people are always requested when they get to the health facility, when they get to the health point where we'll be vaccinating, to indicate to those that are assisting them that generally they usually have this kind of reaction to the vaccination, and then a slightly different plan will have to be made for those people. It's not a big number. I don't believe it's beyond 5% of the population, but they are required to actually indicate so far. There has been a few, we are told, that have, after being vaccinated, had small headaches, but not something very serious, and that is what will have to be looked at. The last two questions that I think I need to respond to. The one is the issue of security. We raised the matter with the minister, and he himself with his team had also started looking at the fact that when the vaccines are transported between the national point to the provincial point, there will have to be security around the vaccines themselves. And that is what is going to happen. They will be protected by the different security programs that are put in place by national. But I'm sure, as you know, security issues are not issues that are really generally discussed. But I think it is safe for me to say yes, security plans are there, both for national and province, and including at our level of districts. Cold storage in place for vaccines, certainly. We get vaccines every day as a province and as a country. This is not the first time we are receiving vaccines. Like I said, we vaccinate our children for measles, we vaccinate our children for mumps, we vaccinate our children for a whole lot of other things. So there is always a storage process that is there in our hospitals, in our clinics. So we do have that system in place, but that is why we also decided that we are also going to utilize the provincial center should our numbers be bigger than what can be carried at a district, at a primary healthcare level, so that we at least know that at any given time, our vaccines are safe and our vaccines are protected. I think those are the only questions I had, Mr. Kwazi.
Thank you so much, Mr. Premier, and to the viewers. The question related to the education employment initiatives, which is part of the presidential employment stimulus or stimulus package. In the province of KwaZulu-Natal, we're given an allocation of 73,000 young people that we had to employ on different categories within this EEI's program. It will include educators, assistants, general school workers, assistants, the screeners, as well as what is called janitors. So the whole package accounted for 73,000. And it's a project that was quite big and very tedious to manage, because the employment or appointment of these 73,000 young people had to be done by SGPs from the month of November, because they were expected to start in December. And as I said, the progress of the program was quite tedious. And upon appointment by SGPs, we had to verify each and every application at a head office level. And that's where we picked up a number of challenges. And we could not first disperse monies just like that on the basis of submissions by SGPs. We had to verify each and every application for the 73,000 people that have been appointed. And there were a number of inconsistencies that were discovered. Some could not comply with the requirements because in terms of the requirements, the person will qualify if he falls within the age category of 18 and 35. So we had a number of people who were above 35, and we had to refer them back to the SGPs. Others were foreign nationals. Others were appointed to be educators, assistants, but they did not have qualification. So those were the processes that we had to verify and confirm or send them back to the SGPs. In other cases, you will have SGPs submitting two lists, which are a reflection of two factions within the SGP. So this group will submit this, the other group will submit that. So we had to deal with all those challenges, and it was quite a tedious process to manage within 1 month. As of today, there are only 5,622 that are outstanding, which still need to be verified. And I can confirm that by the end of this week, all those will have been verified, and we will therefore have completed the entire lot of 73,000 people that we had to appoint. So that was the first challenge, to say we had to clean the data, we had to ensure that we verify that each and every person who is appointed is actually appointed in full compliance with the requirements. So those that have been verified, a majority of them have also been paid. as we know that some will say we have not been paid, others would say yes, we have been paid. The second problem that we encountered was that of 7 billion that was allocated to Department of Basic Education, KZN was given 1.4 billion for this whole project. And that money was supposed to come from national. And December, we could not get any money from national. And we couldn't use the money that we don't have as a province. Obviously, other provinces who are better standing financially were able to use whatever they had to pay. But in the province of KwaZulu-Natal, we did not have the benefit of an extra cash in our coffers. So we really had to wait for national to give us. It's only in January where national said, no, the provincial treasury must use the money that was frozen for salary increases to pay for these EEIs. And now we then started the engagement with the provincial treasury, who then started to release the money in tranches, because there's also what is called the premier cash blocking within treasury. So we are given a certain amount of money per month. So if you unable to balance your expenditure, then it means you will not be able to pay for everything. So we are busy again trying to finalize that aspect with provincial treasury to say, at least for 1 month, give us everything in relation to the program of EEI, so that we disperse to school, because we don't pay them through PESA. We pay schools who then pay these EEIs. So we are hoping that we are not going to have anyone by the end of February saying that he has not been paid. Everyone must have been paid for December, January, and February. The program was designed to run for 4 months: December, January, February, and March. And currently, there's been no indication that there will be any extension. Thanks.
The request is also that if the Premier could also do the Zulu version. Thank you.
Thanks, Mr. Mabaso, siyabonga kakhulu. Ngithemba ukuthi nemibuzo ebuziwe efikelelekile. Okokuqala siyafisa ukubonga and sibonge ukubambisana nabo bonke abezindaba ukuqinisekisa ukuthi siyaqhubeka sidlulisa ulwazi kubantu bonke bakwaZulu-Natal ngesimo esibhekene naso se-COVID. Siyafisa ukuqala ngokubonga umongameli ne-National Coronavirus Command Council ngomsebenzi abawenzayo ukunikezela uholo nokwazi ukuthi sibhekane nalesi sifo esiwumbulalazo. Siyakholwa ukuthi ukufika kwe-vaccine le efikile izolo kuzosilekelela kakhulu ukuthi sikwazi ukuthi siqobe lempi ebukeka izamawala kulo lonke izwe nomhlaba uphelele. And siyafisa ukugcizelela ukuthi njenge-province yakwaZulu-Natal sesenze inhlelo ngokuphelele zokwazi ukuthi ukuvaccinatwa kumbe ukugonywa kwabantu kwenzeke ngendlela esheshayo, kulandelwa imigomo ebekwe i-World Health Organization ngokunjalo ne-Department of Health. Sesakhe ikomiti elibizwa ngokuthi i-Vaccine Coordinating Committee eliholwa inhloko yomnyango wezempilo lapha eprovinsini, uqinisekisa ukuthi lingamela lo msebenzi omkhulu kangaka. Leli komiti linabamele inhlaka ezihlukahlukene okubalwa labo abalapha ngokwesintu, umasipala weTheku, ama-unions, nama-NGOs, ezemfundo yamazinga aphakeme, especially abenza ama-research. Sizokwazi ukuthi kuleli committee sihlanganise lonke ulwazi olukhona ukwenza lo msebenzi ube yimpumelelo. Sizoqinisekisa ukuthi leli committee liyakwazi ukusupporta limonithe ukuthi ukugonywa kuhamba ngendlela kuzo zonke indawo. Lo phase 1 obekiwe siwuhlukanisa kabili. Uma ngithi phase 1 ngikhuluma ngokuthi kushuthi lokhu kokuqala i-vaccination efikile lapha KwaZulu-Natal. Okokuqala sizobheka labo abasebenzi bezempilo ababhekene ngqo nokulekelela abantu uma bengena ezibhedlela. Sibuye sibheke abasebenzi abalekelelayo ngalesi sikhathi kwenziwa i-vaccination process, kumbe ngalesi sikhathi kulashwa abantu abane-COVID. Kulokhu sinabasebenzi abavela kwi-public sector and sinabasebenzi abasuka kwi-private sector. Singasho ukuthi abasebenzi bebonke abangaphansi komnyango wezempilo bangu-163,259. Lokhu kutshena ukuthi ingxenye enkulu yabo ingaphansi kukahulumeni and labo bangu-81,000 bese kuthi u-49,000 ube ngaphansi kwe-private sector, laba abeyibhedlela ezizimele. Kodwa njengohulumeni sizonikezela i-vaccine kubo bonke ngaphandle kokubheka ukuthi omunye umaphi omunye umaphi. Sizoqinisekisa ukuthi ama-site njengoba ese-identifayiwe angu-91 lapha KwaZulu-Natal la okuzosekugonyelwa khona ukuvikeleka kwi-COVID-19 and aspread kuzo zonke indawo. Ayikho i-district noma umasipala ongezokwazi ukuthi ube nendawo yokugoma. Ulwazi oluphelele sizosabalalisa ngokulandela imigudu ezivame ukusebenza ngayo, imsakazo, amaphephandaba nezokuxhumana ezihlukahlukene esiye sikwazi ukucommunicate ngazo. But ngaphe kwalokho sizo-communicate nabasebenzi direct ngoba phela bakhona ngaphansi kwe-department yakwa-health. Uma-ke sibheka izinamba nesimo se-COVID-19 KwaZulu-Natal, sifuna ukuqala nje ngokuzelela ukuthi KwaZulu-Natal iseyi-province yesibili ngokuba nabaningi abake baba nalesi sifo se-COVID-19. Noma kunjalo kukhona ukwehla kwey'namba, especially kusukela ngesonto lesithathu kulonyaka. Ukwehla kwey'namba kuye esontweni lesine ezehle ngo-4%. Kodwa lokho akusho ukuthi sekungcono, yingakho sithi namanje asiqhubeke siqinisekise ukuthi siyazivikela. Kubukeke ngathi iy'namba zokutheleleka kwabantu zidlanga kakhulu eKingcetshwayo ngoba kwezinye iy'khathi iKingcetshwayo iba ngaphezulu ngisho kwetheni, and kuyakhombisa ukuthi kumele sithi ugxila khona eKingcetshwayo. Singasho ukuthi enye yezinto esiphatha kabi ukudlula kwabantu emhlabeni ngoba i-wave yesibili idlule nabantu abaningi kakhulu. Uma ubheka ngokwe-average ngosuku silahlekelwa abantu abacela at least u-75, okuyinamba ephezulu kakhulu. Ngasho ukuthi njengamanje abantu abaseyibhedlela ngenxa yalesi sifo bangu-3,601 baseyibhedlela ayiningi baseyibhedlela lezi eziyimele, kanti abanye baseyibhedlela zikahulumeni. Sengingagcizelela ukuthi iKwaZulu-Natal ikulungele ukuvula iy'kole njengoba sibheke ekutheni kuvulwe ngomhla ka-15 kaFebruwari. Sifuna ukuthi kuqala ukufundisa isifundo sokuqala sifundiswe nge-hour lokuqala ngosuku lokuqala lokuvulwa kwey'kole. Konke obekulindeleke ukuthi kwenziwe ukulungiselela ukuvula njengokuqinisekisa ukuthi stationery, ama-textbooks, i-furniture, amanzi nazo zonke izinto lezi ezibekiwe njengemigomo yokuvikelwa kwi-COVID-19 sezikhona ezingakafiki ziyadilivwa kumanje. Siyafisa futhi ukugcizelela ukuthi abafundi ukubhaliswa kwabo sekuqediwe ngaphandle kwabambalwa mhlambe othola ukuthi ababhalisiwe ngenxa yokushintshashintsha indawo. Yingakho i-department isiyakhe amakomiti azodila nendaba ye-admission kwi-district ne-district. Ukufilishwa kwama-post ey'ndaweni ey'ningi sekuqediwe la okube khona ama-post avulekayo. Lawo ama-post ongaba wo-principals, awothisha nabanye wonke ayafilishwa kumanje. Ngingagcizelela ukuthi ngokwe-infrastructure iy'kole zonke zi-ready except lezo ezimbalwa mhlawumbe othola ukuthi i-damage i-storm or zibe nokuvandalizwa ngesikhathi kuvaliwe, kodwa umnyango usebenza ukuthi zonke zibe ready ukuthi zifunde kufundwe uma kuvuliwe. Ngingagcizelela ukugcina ukuthi nokuthuthwa kwabafundi laba abaya ey'koleni i-department yakwa-education isebenzisa amabhasi acela ku-495, ama-mini taxis nama-taxi, ama-minibus nama-taxi athutha abafundi. Abafundi bebonke abathuthwayo bacela about 42,000 KwaZulu-Natal, and siredi siwuhulumeni uqinisekisa ukuthi bonke abafundi abathuthwa uma baya ey'koleni ngohlelo lokuthuthwa uhulumeni bayathola izinto zokuhamba umhla ka-15. Asivaleke ngokugcizelela ukuthi sifisa zonke iy'kole zivule ngosuku isebenze ngendlela, and sifisela bonke othisha nabafundi unyaka onempumelelo, unyaka ka-2021. Masigcizelele kodwa ukuthi sonke masiqhubeke nokusebenzisa imigomo ebekiwe yokuyivikela kule sifo se-COVID-19. Masigcina sifisa ukubonga sazisa abantu bakwaZulu-Natal ukuthi umngcwabo kaJaji uKhayelihle Kenneth Mthiyane umongameli udesignate ukuthi ubeke ezingeni lokuthi ube yi-special official funeral category 2, and siyafisa ukubonga ukuhlonishwa kukaJaji Mthiyane obambe iqhaza elikhulu kakhulu ekuguquleni indima umkhakha we-legal profession ukuze nabamnyama bakwazi ukuba neqhaza abalibambayo, kodwa futhi uyaziwa ngokumela amalungelo abantu, especially labo abasuka ey'ndaweni ezimpofu nezasemakhaya lapha KwaZulu-Natal nase-South Africa. Umngcwabo wakhe uzoba kusasa eSharpsport eMhlanga, and uyobe sebekwa ngalo usuku olufanayo. Siyabonga.
Okay, asla bukan. Asla. Gimana? Selalu kemana? Kalau nak